and we will get started. So thank you so much, Lyndsay, for doing this for all of us. And welcome to this forum for the Center for Spectrum Services. And without further ado, I'll let you give us some of your background. We're very happy to have you.
Awesome. Well, thank you for having me. So I'm just going to go ahead and share my PowerPoint with everyone. Let's see. And then if there's any point you guys have questions, feel free to stop me and ask those. You can kind of raise your hand or just pop in. I do have a couple of questions throughout the PowerPoint just to make sure everyone can understand kind of what we're talking about. So if you could just respond, the answers are going to be A, B, C, or D. So you can just use the sign language. I think that's a little bit easier than, writing it on a piece of paper. So A, B, C, or D. We can just all hold those up when it's time. So today I'm going to be talking about an introduction to functional communication training for problem behavior. So like Sandy had kind of discussed to everyone, we're going to be looking at the functions of behavior and then also tying that into communication to kind of decrease some of the problem behaviors that we see with our kiddos. So who am I? I actually started working at the Center for Spectrum Services in the summer of 2012. I was in Donna's classroom, so thank you, Donna. So I started there before I graduated undergrad. I was majoring in psychology, but really had no idea what I wanted to do afterwards. I thought I was gonna go be a family therapist, so I really wasn't sure. So the summer right before I graduated, I got a job at the center and absolutely fell in love. So I went back to college for a semester, graduated early, and then returned as a teaching assistant. And I worked for about another year and a half before I decided to pursue a master's degree in ABA, or Applied Behavior Analysis. So I owe it all to the Center for Spectrum Services for kind of showing me what my passion is in life and teaching me what I know and really giving me the building blocks. I learned so much when I was there. So after I pursued my master's degree, I'm currently now a doctoral student in the school psychology program at Mississippi State University. It's also a BCBA program as well, so I became a board certified behavior analyst. And I currently work in the Autism and Developmental Disability Center on campus. So we serve actually college age students all the way down to 2-year-olds. So we do autism diagnosing, and then we do provide ABA services to families each week. I'm also now just moved out of Mississippi to Baltimore. I am completing my doctoral internship at Johns Hopkins Kennedy Krieger Institute. So I will be working again with children with autism and other developmental disabilities, and I will be working in the Pediatric Feeding Disorders program. So it's been about 10 years since I started to work with individuals with autism and other developmental disabilities, and I have loved every single second of it. So again, I think my time and starting and learning what I know now from the Center for Spectrum Services. So what are we going to be talking about today? So first, I'm going to provide a little bit of an overview of FCT, or functional communication training. We're going to briefly go over the functions of behavior, and I'll spend not as much time on this section, but if there are any questions or if you want me to go more in depth, I can definitely do so. So then we're going to go into selecting different modes of communication. So we know the function, so now how do we teach you to request for items? And then after that, we're going to go more in depth about, the actual intervention of functional communication, or FCT. So what is functional communication training? So we commonly call this using FCT. So it's actually one of the most popular and effective treatments for problem behavior. So what we do in FCT is we are going to reinforce and teach the child to use an appropriate communication strategy instead of using their previous inappropriate strategy. So sometimes this can be aggression, this can be yelling or screaming or other inappropriate vocalizations. Some students may use self-injurious behavior to communicate what they want and need. I think, for everyone, we've worked in different classrooms. We can think of different students that have an array of problem behavior. So what we're going to do is actually teach them an appropriate way to communicate what they want without using the problem behavior. So this goes right along with manding or requesting for our wants and needs. It helps a child learn to get the things that they want in the environment. Sometimes it's even just asking for help. It also can include saying no and advocating and expressing ourselves, so protesting, refusing items appropriately. Those are all things that are going to be taught when we're using FCT. So really the main point of FCT is that the response that we are going to teach, it's going to result in the same reinforcer that is maintaining the problem behavior. So if I am punching you in the face because I really want that cookie, what I'm going to do now is teach you to say the word cookie, because that's going to result in the same activity or item or whatever it is that you were previously engaging in the inappropriate behavior for. So we're not just getting rid of behavior, we're actually replacing it. So I don't want to just get rid of your aggression. Yes, that's part of it, but I'm also going to teach you an appropriate strategy to ask for what you want. We know that all behavior is communication. So again, FCT is just a way to teach you to appropriately request for what you want. So there's a couple of basic components of FCT. So the first thing that we need to do is identify the function or reinforcers that need to be delivered. So this is kind of figuring out, why is the behavior occurring? We want to figure out, when we're identifying the function, what the child is trying to communicate and what they are asking for in their environment. After we've identified what the child wants or what they're using the problem behavior to kind of ask for, we can then identify the different communication act that we're going to teach them. So what method are we going to use? We work with kids that, use sign language, some use vocal speech, some use, our augmented communication devices, picture exchange systems. So we have to decide which method or mode of communication we're going to use. After that, once we decide, okay, we're gonna maybe use a PEC system, we need to determine when and how we're gonna teach the new response. So in what context? Is this only gonna happen when we are at the dinner table and that's when you're engaging in the problem behavior? Do we need to teach you that you can ask for something in the presence of mom, but you can't ask for it in the presence of a stranger on the street? So we really need to determine the situation, the context, that we can teach the response, and in the context or situations where the child, it's not appropriate for them to use the response. So those are all things that need to be figured out prior to starting our intervention. So what are the functions of behavior? So the functions of behavior is actually based on the idea that all behavior serves based on the assumption that behaviors either provide access to something an individual wants. So that could be access to mom's attention. That can be access to my favorite toy or, my favorite candy. Also getting sensory input. I like to have scratches or rubs on my arm. And then also, there's also the removal of things that we sometimes find aversive. So sometimes I really don't want to do those math problems. So I may be engaging in problem behavior to escape every time you put that dang worksheet in front of me. Sometimes I don't want attention, so I really don't like when you're giving me negative attention or yelling at me. Or I don't like positive attention, so I don't like when you give me compliments. Sometimes we'll engage in things to remove discomfort. Some individuals will engage in self-injurious behavior because they are in pain, or we're scratching to remove an itch. So all behavior either provides access to something or removes something that we find aversive. Oops. So, like that kind of picture of our lovely cat described, there are really 4 main functions of behavior. So one would be our access to our tangible items. So that's getting access to preferred activities, to preferred items. So if they have a favorite toy, they have a favorite edible item such as pretzels or chips, those types of things, going for walks, going to play on the swing. Those would be all examples of tangible items. We also have our attention function, and this can also take a variety of forms. So maybe I'm engaging in the behavior because I really like when you reprimand me. I think it's funny. I may be engaging the intention in the problem behavior because I really want your positive attention. I want you to tell me I'm doing a good job, or I want you to play or sing with me. So those would be example of behavior that would be maintained by attention. We also have escape or avoidance. So if the task is already happening, I may kind of punch you or, start screaming because I want to get out of the task. Or I know that the task is coming and I want to completely avoid it, the whole thing. So I'm going to also engage in the problem behavior to avoid. This can also be escaping social interactions that we don't like, or avoiding social interactions. This can be escaping work that's too hard, escaping work that is going on for too long that we don't like. So there's a variety of things that would be maintained by escape or avoidance. And then lastly, we have our automatic reinforcement function. And this is kind of the function behavior that feels good. We do it because it doesn't matter of anything else in the environment, but it's what kind of feels good to me. So common examples of this, we may see kids that will rock or hand flap. So those are behaviors that are not mediated by anything, by any social function in the environment. Those are just what feels good to me. So how do we determine the function of behavior? This can be really, really challenging, and there's 3 different ways or kind of collections of tools that we will use to determine the function of behavior. So there's 3 increasing intensity assessment procedures. So our first one is going to be our indirect methods. So those are our interviews, asking the teachers, what happens when he screams? Do you give him the toy? Do you remove the work? So kind of gathering all the information you need to determine the function in an indirect way. So this could be rating scales, different formalized interviews, those kinds of materials. We also have our direct or descriptive methods of determining the function. So a common example of this is our ABC data collection, our antecedent behavior consequences. So I'm going to sit in the classroom and I'm going to watch you for a while, and I'm going to write down everything that happens right before the behavior occurs, which would be our antecedent. And then I'm going to write down what the behavior is that's you're engaging in, and then write down everything in the environment that is happening after the behavior occurs or the consequence. And that's going to kind of help me determine what are the common things that are provoking you or, evoking the behavior, and what is maintaining the behavior. So, I'm watching you in the classroom, and every time you scream, the teacher comes and takes away the worksheet, or every time you kind of punch me, I ask you if you want to go play on the iPad for a little bit. So looking at what some of the major things happening in the environment are. And then our last method is actually the gold standard for determining the function of behavior, and this is called our functional analysis. So this is actually an experimental way that we can determine the function of behavior. Our indirect methods and our direct or descriptive methods can only really show us correlations between the environment and the behavior, but our functional analysis actually tells us this is exactly what is maintaining the behavior. And what that looks like is the child will kind of go through a series of conditions where we intentionally kind of evoke the behavior. So, for example, in the attention condition of the functional analysis, and we test for attention, we test for tangibles, we do an alone condition where the kid can kind of just be by themselves, and that's how we look for automatic reinforcement. And then we also provide demands and look for escape. So in the attention condition, I'll be playing with you for a little bit, maybe 2 minutes or so. Then I'm actually going to remove the attention, and then during that condition, every time you engage in the appropriate behavior, I'm going to give you attention back for a brief period of time, then remove the attention again. And what this shows is that in the condition that has the highest rates of problem behavior, that's the condition that lets us know what the function of behavior is. So for example, in the attention condition, if you're engaging in 20 instances of problem behavior, but in the tangible and escape condition, you only engage in it five times, I know that it's probably maintained by attention. So again, this can be a really complex procedure. It's not often conducted in classroom environments. There's different variations of this that would be better suited for classrooms, but it is the only method that would be able to truly determine what the function of behavior is. So here's an example. I know with talking with Sandy that some of you guys commonly use the questions about behavioral function, or the QABF. This is just another example of another kind of screening tool. This is called the FAST. There's also the FAST-R, which is the revised version. And this just goes through different questions to try to kind of pinpoint what the specific antecedent or consequences are. So, for example, if we're looking at something that would be attention maintained or that has a social influence, the question may ask, this behavior occurs in your presence or in the presence of others. We can also look at when he received attention. So there's different variations of these different screening tools, but they all try to hone in and pinpoint on what the function of the child's behavior is. This is just an example of an ABC data collection. So like I said before, we're looking at different antecedents. So was he alone? Was he just given a demand? So I told him to pick up his toys, or I placed a worksheet in front of him. What behavior happened of the ones that we're looking at? And then again, the consequences. Was he ignored? Did he get the worksheet removed from him? Did he receive attention for that? So this kind of, again, helps us look for common themes that are happening within our environment to determine the function. So with these, it's not always that easy. You can give different teachers these different questionnaires, and one may say, oh yes, it happens for attention. And the other may say, oh yes, it happens because he really wants that iPad. So it would be a tangible function. So that's why it's hard, and it's, you have to kind of weed through and kind of see what's happening. The same behavior can also serve multiple functions. So I may punch you when I really want the iPad, but I may also punch you because I really don't want to do my work. So the same topography, or what the behavior looks like, may serve multiple functions as well, or what they call it may be multiply controlled. So that is something to definitely consider as well, and an important part to consider when we're teaching them to communicate a response. It also helps, when we have the same behavior, to look at the antecedents, or what's happening in the environment before the behavior is occurring. I know that if I placed a worksheet in front of you and then you hit me and I remove the worksheet, I'm going to need to teach you something for escape. But if I took your iPad away and then you punched me and I gave the iPad back, now I'm going to have to teach you a response that communicates that you want access to a tangible item. So really looking at both those antecedents, or what's happening before the behavior, and the consequences. So this is going to help determine what you're going to teach the child to request for. It's also going to determine what the specific words or picture icons or anything of that nature for what they want to request for. So we know that the child is engaging in the behavior and it's escape maintained. So he's doing it to escape. But is he doing it because the work is too long? So he doesn't mind working for 5 minutes, but when I have to work for 10 minutes, ooh, I really don't like that, so I'm going to engage in aggressive behavior. In that case, we want to teach the child to request for a break, or to say, I'm all done, I'm finished. If you're presenting a worksheet and the child engages in the aggressive behavior, is it because it's too hard? In that case, he doesn't really need a break, he needs assistance with the work, so we're going to teach them to request for help. Going along the same lines, if it is just the worst thing in the world and I really don't want to do this, I'm not doing it because I need a break. I'm not doing it because I need help. I just really don't want to do this. And in that case, I would just say, no, thank you. So we really want to look at what is it within that escaped maintained behavior. So that's looking at our different antecedents and the consequences that are going to help us determine what we're requesting for. Is it break? Is it help? Is it no thank you? And those sorts of things. So we're going to do a little practice. So I want you guys to determine what the likely function, again, we can't really know without doing a functional analysis, but just from gathering some of this information. So Katie is a 10-year-old female who engages in screaming and crying frequently throughout the day. It is most likely to happen when Katie is not engaged in a preferred activity, such as swinging or playing with her Frozen dolls while watching a movie. To stop her from crying, Katie's parents let her outside to play or give her an iPad so that she can watch Frozen. So what is the likely function of Katie's behavior? Everyone can hold up A if you think it's A, B, C, or D.
Definitely C.
Good. So the answer in this case would be access to preferred activities or tangible. While she is still getting attention from her parents when they're letting her outside, if we look at the antecedents, she's not engaging in it when she has access to her preferred activities. It's when those are removed that she engages in the behavior. Then when she engages in the behavior, her parents give her access back to her preferred activities of going outside and watching Frozen. So in this case, the likely function of Katie's behavior is going to be access to preferred activities or a tangible function. Does that make sense to everyone? Awesome. All right. So really briefly, that's how we identify the function or reinforcers that need to be delivered. So we know what you're trying to ask for. You're trying to ask for the iPad. You're trying to ask for a break, or you're trying to ask for help. But now what am I going to use for you to ask for those things? So the next part of functional communication training is identifying the communication act that you're going to teach. So what mode are we going to use? So we've worked with many kids that have different ways of kind of communicating to us what they want and need. Some of our kids use vocal speech, whether that's, one word phrases, multiple word phrases, using picture exchange systems such as the PEC system, using voice output devices. Some of our kids use sign. Some of our kids may just use other gestures, so pointing, facial expressions, eye gaze, and then some kids may use a different mode of communication. And sometimes this may be good. I had a child one time, he was about 14, and he communicated primarily using Proloquo, which is a thing that he also had on a phone. They also use them for the iPad, so you touch the icon and then the device will say the word. So if you touched water, it would say water. So he used this pretty well until one day he actually had two devices just in case one died. He always had access to another one. Well, I was doing an in-home session, and we went for a walk, and the parents hadn't charged either of the devices that day. So when we went for a walk, both of them died. So we continued our walk, and we started to go back to the car, and all of a sudden he just pulls down his pants and started to go to the bathroom. And this is a 14-year-old, so I'm trying to get him away, and I realized he didn't have any means to tell me that he needed to use the restroom. So after that, we started to pair sign with our device so that he could always communicate when he didn't have a way to, because a 14-year-old going to the restroom in public was not a good thing. So we were able to work through that and kind of teach him to use different communication systems if he wasn't able to rely just on one. So there's all of these different options. Which one do we choose? Well, the first thing that you want to look at are existing skills. What skills are already in the learner's repertoire? So does he already primarily communicate using vocal language, or does he already primarily communicate using sign? We also want to look at which one is the most efficient for the learner. So the more efficient it is, the less likely they're going to be the less likely that they're going to use the problem behavior to communicate. So for example, if I let's say I engaged in self-injury when I wanted to have access to my iPad. Well, if you're going to teach me to communicate, to ask for an iPad, but you need me to walk to the other side of the room, you want me to pick this up, I have to open another container, I have to reach in and find an icon, and then I have to go over here and get this icon, that's not really efficient right now. It's way easier for me to just do this to get you what I want than have to engage in this lengthy process. So you want to make sure that when you're initially teaching, that you are looking at what is the most efficient method for the learner. That's why for some of our kids that use picture devices, it's so important to have straps or something so that they can always carry around their books, because that's their voice. Also, sometimes looking what the learner prefers. So again, like they're more likely to use method of communications that is the most efficient, rather than engage in relation to the problem behavior. Which one do they prefer? So that will increase a long-term use of the response if they actually enjoy the mode of communication that they're using. And just like how we conduct preference assessments to see what the child's favorite, toys are, so we give them a choice between toys, we let them walk around in the room and we find what their reinforcers are. You can actually do the same sort of preference assessment using different modes of communication. So you would be able to teach the kid to request using sign and to request using a picture exchange system. Have both of those available and ask the child what he wants, and some of the children will be able to pick which one that they prefer. So if you gave them a choice between sign and the picture exchange and said, do you want the iPad? They may use the sign for iPad rather than using the picture. Some children may use the picture instead of the sign. So it's really important that you're also looking to see if the child, prefers and enjoys the mode of communication that they're using. And this is all, again, what we want to do is decrease the desire to engage in the problem behavior. So if we gave them an easier response, they enjoy the response, I'm more likely to use that new response than engage in our old problem behavior. So again, this can be really challenging. We always consult with our speech language pathologists, but here is an example of kind of selecting, taking different things into consideration when we're trying to select which mode of communication would be the best for Bob. So Bob is an 8-year-old male who engages in self-injurious behavior to get access to tangibles in the form of his favorite candy. I hope it's Kit Kats, because those are my favorite candy. Bob has a limited imitative repertoire, so that means he has a really hard time when you're asking him to imitate things. If you say touch nose or, do this or do this, he has a really hard time. He also has a difficulty with his fine motor skills. So he's currently non-vocal, and right now he just communicates primarily through gesturing and pointing, but we want a different, better mode of communication, because that's so difficult for our caregivers to understand, which is causing the problem behavior. So which would likely be an appropriate alternative mode of communication for Bob? Would it be A, sign language, B, a picture exchange system, having him say candy, or none of the above? Yeah, so in this case, probably the most efficient one for him, and the one that may be more preferred, would be a picture exchange system. If he has a limited imitative repertoire, it's going to be hard for him to learn the signs when we're saying do this. Also, with his fine motor skills, he may not be able to do different signs. So in this case, we maybe want to use a picture exchange where all he has to do is grab an item, point to an item, if he can't actually exchange it. Having him say candy would be way too difficult right now, because he is currently non-vocal, and we don't really want him to use his gesturing and pointing anymore, because this is very difficult to understand. All right, so we've identified the function. We've looked at choosing one of the different methods or modes of communication to teach. Now, how do we teach them using FCT? How do we teach them to use, their words, or to exchange a picture instead of punching me in the face to get access to the iPad? So this is the last part of what we want to look at with FCT, determining how you're going to teach the response and in what context. So the when and the how are we going to teach the new response. So it sounds pretty simple. It can get a little complicated, but the three main components that we're going to use in FCT are reinforcement, which we know is increasing the behavior; extinction, which means we're going to withhold reinforcement for the behavior, so the behavior will decrease; and then we also use prompting. So for example, say that you want the iPad and there's a tangible function. So instead of hitting your head for the iPad, I'm going to teach you to touch a picture card that has a picture of the iPad on it. So I'm going to hold up the iPad, put the picture card in front of you, immediately prompt you using our different prompting strategies to touch the picture of the card, and then deliver the reinforcer of the iPad. If you engage in any of this, the reinforcer will not be delivered. So we place our problem behavior on extinction. So I'm going to show you guys an example real quick and kind of talk you through what you are seeing. So I'm going to actually share this video, and this is a video from put on by Wayne Fisher, who was previously at the Monroe Meyer Institute. He's now at Rutgers, but he is someone who has a lot of experience in dealing with severe behavior. So this is actually, the Monroe Meyer Institute has a severe behavior program. So you will see that the therapists in here have, arm guards on and protective equipment, because they typically work with children that display pretty severe problem behavior. So this first video is how to train this functional communication response. So like we already talked about, you want to select a simple response that can be prompted. So we're looking at the most efficient one. You want to kind of make opportunities for this to occur. So just like in manding, where we say we're teaching you to man for items, we want to remove them to the shelf, so you have to ask for them to be delivered. We want to contrive those opportunities for you to ask. So in this case, they're going to remove the iPad so that he has to request for the iPad. They're going to go ahead and physically prompt the student to touch the picture card on a one-to-one schedule reinforcement. So you touch, I give you the iPad. You touch it, I give you the iPad. And then we're going to start fading that prompt level, which you all typically do in the classroom when you're using prompting. And then all problem behavior is going to be either blocked or ignored because we're putting it on extinction. So we're withholding the reinforcement for that problem behavior.
Give it to me. Good job touching the card. Give it to me. Good job touching the card. Give it to me. Good job touching the card.
So there she gave an opportunity for an independent response before she prompted.
Give it to me. Nice job touching the card, Katie. My turn. Nice work touching the card.
So you see there, instead of where the child is used to hitting somebody to get access to the reinforcement, they're going to block and ignore that behavior, wait a couple of seconds, immediately prompt the appropriate response, and then deliver the iPad. They are a little forceful with their response, so I probably wouldn't do it that forcefully, but I think they're trying to exaggerate them doing the picture touch for the card.
My turn to play. Good job touching the card, Katie.
Again, blocking and ignoring that problem behavior.
My turn to play. Nice work touching the card.
Okay, so in that case, what they were doing, so again, they're just prompting the student to touch the card, so the child learns, okay, when I touch this card, I get access to what I want, instead of using my aggression to get what I want. So that is just a simple example. Again, I wouldn't do it as forcefully, but they typically work with children who display pretty severe problem behavior.
Lyndsay,
Yeah.
was that those were two teachers doing a demo, right? That
They
wasn't
were
a real student.
No, that wasn't. Those was two therapists that were doing a demo of the problem behavior and how it would work.
Right. So I think maybe that they were doing it almost exaggerated to just
Yes.
to make a point.
That's exact. Yes, they were trying to show how we, select the response, and that's what you have to do.
Okay. So that
Yeah.
makes a lot more sense.
Yes. Yeah.
'Cause I
They're
think-
trying to really demonstrate, how that would look like.
Okay, good. Because I think we too were a little taken back by the force.
Yes.
So good to know that was a colleague and not a student.
Yes. And for some of these individuals too, like at the Monroe Meyer, Kennedy Krieger also has a severe behavior Marcus Autism Center. I think too with this particular student, if I can remember, that they use, he typically did the slap anyway, so I think that they were trying to kind of exemplify that. But they, FCT is, used so much in these clinical settings. I went to a training one time with these individuals, and they actually were giving an example of one of their clients, and he had engaged in such intense self-injurious behavior with headbanging that he actually had damage to his spinal nerves back here. So one more headbang would have probably paralyzed him. So they ended up using FCT to teach him just a simple tap, I give you back what I want, so that we're not evoking that problem behavior because it was so dangerous and so life-threatening. So it was a quick, simple tap, I give you what you want, and then what we're going to talk about in a little bit is how do we kind of go from there. So it looks pretty simple, right? Every time I ask for iPad, I get iPad, so every time I get a cookie, I ask for cookie. I wish this was a case, because every time I ask for tacos, I wish that I could have tacos. But that is not how life works. So in some cases, this new response can't be reinforced. So we're going to have to teach other interventions or support during this time. And that's teaching the kid to learn to regulate behavior. You see this with manding a lot. So we teach the kid to ask for candy, and every time you ask for candy, I'm going to give you candy. But that's not how real life works. So we kind of start to have to fade away from that. So what we want to do is we want to thin that schedule of reinforcement. And what I talk about when I say that schedule of reinforcement is when you're teaching behavior, every time you engage in the behavior, I'm going to give you the reinforcer. Now every maybe 2 times you engage in the behavior, I'll give you a reinforcer. And now every 3 times. So that's thinning the schedule of reinforcement. So we want to do that to kind of approximate what the natural environment is like. So in the natural environment, I don't get a cookie every time I ask for one. So we kind of need to teach the kid when he can have a cookie, when a cookie is not available, who to ask for a cookie. We can't go asking strangers on the street for a cookie. And then we also have to teach tolerance for delays to reinforcement. And this can be really, really hard. And I know we have all seen this a lot with a lot of our kiddos, where you ask them to wait for the iPad, or it's not time to have candy right now. So that's something that we would have to explicitly teach. And that can all be part of FCT. So we get them to do the response reliably. So when they touch the iPad card, they get access to the iPad. Now we need to teach you, okay, when you touch the iPad card, you may have to wait a couple minutes for the iPad, or right now, iPad just is not available. So how do we go about teaching that? And a lot of the things that we can use are what we call antecedent-based intervention. So this is kind of preventing the problem behavior from preventing the problem behavior from occurring. So it's implemented before the problem behavior occurs. That's why it is an antecedent intervention. Because we all know that when the kid is in the middle of a big meltdown, it's really hard to deliver any sort of intervention. So it's easier to deliver the intervention when the problem behavior is not occurring. So how do we do this? One, we can use different signals. So when reinforcement is available, this can be the same as I have a green card, and when the green card is out, I can ask to go play on the swing, or I can ask for the iPad. But when the red card is out, that means that those things are not available. When we're using some of our picture exchange books, sometimes we can just take icons out, or those can go in the back of the book, because that shows that right now reinforcement is not available, and that actually kind of prevents the child from asking for candy when it's 7 o'clock in the morning, and candy is definitely not available unless you're at your grandma's house, and then it typically is available. We can also look at what we call demand fading. So that's the increasing the amount of work before reinforcement is delivered. So we had a kid who absolutely hated doing any sort of work. He engaged in horrible problem behavior. He had broke a window in our clinic, throwing things. He engaged in biting, throwing. He put bruises all over one of our other therapists. So what we did was what we called demand. We used FCT so he could request for break because his behavior was maintained by escape from demands. So we taught him to, when he touched the break card, he could get access to a break and the work was removed, but that's not always, again, how life works. So what we had to do was demand fading. So he engaged in one response, he got access to a break. Now, once he was reliably doing that and doing it well, we moved to he had to do 2 responses before he got access to a break. Then over time, it was 3 responses before he got access to a break, so on and so forth, until we were actually up to 10 different responses, and he was working for about 30 minutes at a time, where before it was probably about 3 seconds that he would tolerate any sort of demands in front of him. And we saw problem behavior decrease to about 0 levels. We can also use graphic aids. This is awesome when you guys are using your visual schedules in the classroom because it shows when recess time is, or it shows when lunchtime is, and that's when I can get access to the swing and I can get access to my preferred lunchable or other edible item. So this shows the student when the activities will occur. A lot of good things with this too is you can actually give the student choices. So, for example, with work, they could choose that they have to do, 2 work problems and get access to an item that's less preferred, or they can do 10 work items and go get to play on the swing. So giving different choices between work that's kind of match the amount of reinforcement they will get. This is definitely helpful with a lot of our kids as well. If they can tell time, showing them the time that they have to work, using I know with the younger kids, we use our pictures to show our different activities. We also use timers a lot, and that can also signal when reinforcement is available. So we put the timer on for 2 minutes. Oh, when this is over, then you can have the iPad, and we're teaching the child to wait and kind of tolerate that. And again, we can increase that time as the intervention goes on. So we're going to watch another example going to teach this. So they taught the kid to use that communication response, but now the iPad is available and when the iPad is not available. And then you're going to reinforce waiting for the child as well to get access to the iPad.
Good waiting. Nice work touching the card.
So in that case, they're doing it super fast so the child learns, but in the green card, tapping the card gets access to the iPad, but in the presence of a red card, if she were to tap the card, she would not get access to the iPad. So this is a good way to kind of signal to the kid when they can request for items and when they can't request for items. So she's blocking access because it's not available. Now it's available,
Nice touching the card, Katie.
and now touching the card will result in access to the iPad. iPad is no longer available. So we're still putting those inappropriate responses on extinction. I don't care that she's touching the card because iPad's not available. Now it's
Nice
available.
touching the card.
Again, ignoring all the
Good
behavior
waiting.
during this time.
Nice job touching the card.
And eventually, over time, the child starts to understand that relationship between the red and green card and when I can ask for those items.
Good waiting. And awesome job touching the card. Nice work waiting, Katie. And good job touching the card. Great waiting, Katie, and good touching the card.
Okay, so you saw that she's also providing specific praise, so good job waiting, good job touching the card, so that you're labeling what the child's doing that's resulting in the reinforcement. So here is also another example as well, and this is increasing the tolerance for the delay as well. So when they're reliably touching the card, we're going to increase times where it's available, and then also times again when it's not available. Increasing praise for waiting without problem behavior, and then getting access to the reinforcer, which again in this case will be the iPad.
It's my turn to play. Good touching the card. My turn.
So now she's just using the removal of the card to signal that the reinforcement is not available.
Good touching the card, Katie.
Now the card is back, so she can ask for a card. So this is sometimes when we're using picture exchange, we take those cards out of the way, or when they're not available for the child to request for them. So this is just another example of a
My turn
way
to
that we
play.
could teach when they
Nice
can
work touching the
request
card.
and when they can't request.
My turn to play. Good waiting. And nice job touching the card.
And if you notice at first, what she's doing is just doing really quick wait times for the child as well. And then eventually over time, you can increase the time that the child is waiting.
My turn to play. Awesome job touching the card, Katie. My turn to play.
And again, ignoring all problem behavior because we're putting that on extinction during FCT. So we're withholding reinforcement for engaging in the problem behavior. You do not get access to the iPad when you're engaging in aggressive behavior.
Good waiting. Good job touching the card. I'm gonna play now. Nice touching the card, Katie. Katie, draw a line. Nice job drawing a line. That's right. My turn.
So now what they're going to show is how we can kind of start to increase work and increase demands during that time as well. So what you'll see is she's going to go back to using the red and green card to signal when the child can ask for the reinforcement, and using the completion of demands before the child can get access to that reinforcement.
Good touching the card nicely, Katie.
And here what she was doing was withholding reinforcement for her slamming the card, and having her get reinforcement for just touching the card nicely.
Touch the card nicely, like that. That's touching the card nicely. My turn to play. Touch the card nicely. Touch the card nicely like this. You do it. Good touching the card nicely.
As we all know, we have those kids sometimes when we're doing the picture exchange, and they'll take the card and they'll throw it at you, or they'll rip it off the icon picture. So this is just a way to kind of shape up that appropriate communication response if the child is used to kind of slapping the card or engaging with it inappropriately. And now this is the red and green card.
Katie, draw a line. Nice job drawing a line. Write your name. Good touching the card. You can have a break. Katie, trace the line. Nice job tracing the line. Trace that line. Good job tracing the line. You can write your name. Good touching the card. You can have a break.
So again, now the child can ask for a break when the card is on green, so that signals reinforcement is available. When the card is on red, they have to do their work and they cannot ask for a break. And this is helpful because sometimes when we teach this with kids, we teach them to ask for a break. Well, guess what? Every time you put a demand, they're going to ask appropriately for a break. But now we need to teach them, like with demand fading, that we're going to increase those demands and even signal when they can ask for a break and when they cannot ask for a break. And again, this is important too, as you know, sometimes there's just certain things that we cannot say no to. So, you know, if I'm asking you to eat anchovies, you can say no, but if I'm asking you to take your medicine, that's something that you can't request to say, or you can't protest or say no for. So we teach the child examples of when it is appropriate to ask for things and when it's not. So with FCT, it isn't the simple FCT. It's just not enough to just teach the child to make a request whenever someone's present. So I can't just always ask for a cookie and I'll get the cookie. So it's really important that you're using strategies to teach when it's not appropriate to request using the new response. So teaching it in the right setting. I can ask to, you know, I can get tickles at home, but when we're in the middle of Target, I can't ask for tickles. When is the right time? I can't ask for candy at 6 o'clock in the morning, but I can ask for candy in the afternoon with it when it's with the right people. So I can ask for kisses from mom, but me asking for kisses from a stranger is not appropriate. And also during the right activities, again, like I said before, you can say no when I offer you, an unpreferred food, but when you have to take your medicine, that's not an appropriate activity to say no to. And so overall, what we really want to teach the kid is when it is socially appropriate to ask for things and when it's not socially appropriate to ask for things. So we've kind of talked about how to identify the function of behavior, the communication after, how you're going to teach the kid to engage in that behavior, and then how you're going to teach the response. And again, in what context, what time, with what people, with what activity, those kinds of things. So just to kind of close, and then I'll take some time for questions and to kind of go back and cover anything that wasn't clear. I know we kind of breezed through. We could probably spend a whole day going in depth and talking about functional communication training for problem behavior. So one of the biggest things for kind of increasing the success of FCT is that you want ongoing, consistent reinforcement of the new response. You want to make sure that the kid learns and knows that when I use an appropriate response, that's when I get access to whatever it is I'm asking for, not when I engage in the inappropriate behavior. So in that sense, you want to stop or reduce the reinforcement for the problem behavior. So I know that if I'm asking for candy and getting candy that way, I am less likely to punch you for candy because that's not resulting in me getting candy anymore. You want to teach commands that are recognized by others. So, you also want, like we talked about before, that are efficient to use and also preferred to use by the individual. So you want the child to want to use that, not when we're just prompting them to use the response. You also, just like with manding, you want to have multiple opportunities for the child to mand in the day. The same thing with FCT. So you want to kind of enrich the environment with opportunities for them to engage in this new response. Just how she was taking the iPad away, having them do the response and giving it back for quick periods of time, that's a great opportunity to get multiple trials of teaching that new response in there. You want to use high rates of reinforcement when you are initially teaching the response, so that 1-to-1 ratio. And then this is also going to be important when the child needs to wait for reinforcement, because they know this is the response that gets me, and even if I have to wait, not the problem, not the inappropriate behavior. So I have a couple minutes. Thank you all for kind of tuning in and listening to this, and I'll take some questions or comments. And here is a throwback picture of when I worked at the Center for Spectrum Services that I dug back to 2014 to find. So if anybody has questions, or you can unmute yourselves and ask those.
So I think I think instead of people just sort of jumping in, because it might get a little bit difficult, I've asked people to use the chat. So if people could use the chat, Lyndsay, and then I can read the questions, that would be helpful.
Sure.
I think one of the things I just, as a practice that we tend to not do is to, if the child is using picture exchange communication, is to take the item away. So that is, it's interesting that you had mentioned that, because as a practice we found, so let's say the child had vocal words, you could never take a vocal word away. You could scream cookie, 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 cookie all day long. So we too have decided as a practice not to take it away, but to explain cookies are all done. You can't have a cookie, but you can have this. Or the cookie box is empty. Cookies are done instead. So what's your thought about not taking it away?
So that would be, for some of the kids, it's really just kind of teaching them when it can or cannot be taken away. So just like you're saying, you can never take away our opportunity to ask, but it's just more of a way to teach them. So in that case, rather than taking the picture icon away, you can just go ahead and use like the red or green card, or keeping the icons there, but just having a pile that says, okay, these are things I can ask for right now and things that I can't ask for right now, so they could still get the picture to you just like how you would still use the word, but they're not going to produce the reinforcement. So that just may be a better way then to use like the what we call an SD or discriminative stimulus to show that, yes, this is a time that you can ask for that item, and this is when your request will be honored, and this is a time where your request won't be honored.
And one of the things that goes along with what you're saying is, you know, the red circle with the line through it that indicates no,
Yes.
right? So now I've seen people create those not available or not now, or basically those stop signs,
Yep.
and they put them on top of the card to say, I'm not taking your word away, but you definitely cannot have this, this, and this right now.
Yes, that's exactly it. Because some kids, you know, if the card is, they will ask all the time. It's just like the kid, you know, that's like, mommy, 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 trying to pay it, you know, trying to ask for their attention. So we're not taking it away. We're just showing you that your request won't be honored at this time.
Right. And Lyndsay, the other thing too is, what would you say? So the example that you showed in the video, just for the clarity of people, that was
Yeah.
not picture exchange communication training,
Correct.
right? So I didn't want people to think that that was a new form of training.
Nope.
I wanted people to, what would you say is the profile of a student with that type of behavior response that you were teaching? What would sort of be the developmental profile?
Sure. So that one, you know, when any student that, you know, has difficulty, you know, waiting and needs a simple, easy, efficient response to start out with, would use something like this, or it's as simple as the touch of a card. So for the example I talked about before, where the kid was so used to headbanging, engaging in self-injury, but it was so dangerous, they needed just the simplest, easy, communicative response to teach the child to engage. So it was less effort than engaging in the injurious behavior. So for kids, when you just need a simple, easy, effortless response to engage and to teach, that's when you would use something like this. So there's the difference between PECs and a picture exchange is PECs is, you know, the manualized intervention. Picture exchanges is exchanging. You can work up from just touching the picture to then having to exchange the picture once you get behavior under control. Because now exchanging the picture becomes more a response effort. So if we just need a simple, easy response, you would start with just the touching the picture, and then you can move to, you know, a full picture exchange from there. But definitely to start out with, you need, you know, when you have a child that's engaging in such severe, you know, aggression or self-injury or inappropriate response, and that's what they've been used to for so long, we need to give you another really attractive alternative to engage in, which is the simplest, easiest way to communicate. We made it too complicated from the beginning. I'm going to go back to my old way of, you know, punching you or doing whatever I want because that's what I'm used to, if you make the new response too hard for me to do. So that's, so those kids, but I've seen that FCT with just the touch of the picture used with anywhere from, you know, 3-year-olds up until we had a 18-year-old that was probably about 300 pounds that it took, you know, it was pretty dangerous self-injury, and that we use that with as well. But then I've also used this with the kids just requesting break please or cookie please. So using vocal language, I've had kids using this with sign. So again, that really kind of goes back to selecting the mode of communication that would work best for your learner.
You must have in your experience some pretty significant turnaround, right? So in behavior, so parents that bring their children to the clinic, significant self-injury. Can you just talk real quick about, you know, maybe an example of what the student came in with, how long, what the intervention was like, and then
Sure.
how it changed the person's life?
Yeah, so I actually, one of my clients that I did in-home with, he engaged in pretty significant self-injurious behavior and also aggressive behavior. So during his tantrums, any glass item in the house would be thrown. He would throw vases. He would also headbang into hard surfaces. So he had like a stainless steel fridge. The whole front of the stainless steel fridge was dented from where he hit his head. He actually had like a permanent kind of egg on his head from where he would engage in that. If he would go outside, walking through a parking lot and mom would take the iPad away, she actually had to call insurance companies because he dented with his head another person's car in the parking lot on one occasion. So once we determined that it was, he engaged in that response when it was to get access to tangibles, which was his iPad. He loved to watch Elmo on the iPad. And that it mostly happened when those preferred items were removed. We were able to implement FCT. So he did have some vocal language, so we taught him to request for iPad. Then once he did that, then we were able to teach him to wait and then also work for the iPad. So he, when we first started, was spending maybe 80% of his day on the iPad. We got him down to, even in our 2-hour sessions, he would maybe use the iPad for a total of maybe 5 minutes, and those were like 1-minute segments of reinforcement. And we decreased his levels of self-injury to almost zero rates, so that he could go out in public with his mom, and his mom didn't have to, hold on to him, like whenever he was near hard surfaces, or your stomach would drop every time you watched him, kind of hit his head thinking it's just going to split his forehead open.
And so it sounds like you did a lot of conditioning new reinforcers as well as just, yeah. Okay, so it was asking for your iPad in an alternative way, but also conditioning new reinforcers so that you found lots of other things he liked.
Correct. Yeah. So once he was able to learn to access, that, then we kind of put in, okay, we have to do your chores first. So make the bed. We have to do this homework. We can go swing for a little bit, and now reinforce. And then once those activities are completed, just how she was having the kid kind of draw their lines, that's when reinforcement is now available. And when you ask for the iPad, it'll be honored. So that kind of fades them away from relying heavily so much on the iPad as a reinforcement. He can still, use his new communicative request to ask, which is appropriate, but it's going to be honored, at normal times rather than spending our whole life in front of Elmo on the iPad.
Right. That's great. If anybody has, I know, Lyndsay, it's already 10:40 and we appreciate your time so much. We know you've got a lot to do. You just moved in to your new apartment.
Yes.
Donna Lewis says, hi, doctor. So, yeah. So, and Jamie wrote into the chat, and she said a big thank you. Thank you for sharing your expertise.
Of course. Yeah, I can take I don't mind if there's any questions or things that you would like me to clarify, or I sent the PowerPoint so everyone can have access to the videos and the link to that video, and also the slides as well. And then I did one of my favorite books that I had in class was actually this guide. It's called Functional Communication Training for Problem Behavior. So that is kind of one of my go-to books as a clinician.
Oh, that's great.
And I put that at the end of the PowerPoint as well.
Oh, thank you.
Yeah. Yeah. Is there any questions or anything, that you want me to clarify, or?
I don't want to hog the questions. I have questions, but I don't want to hog them.
That's okay. I don't mind at all.
Okay, good. So I know in the beginning you talked about feeding, and that the direction for your doctoral program is going to be engaged in the feeding clinic. So just to let you know, and I know we talked about it briefly. So as you a big part of our component during the week is the food exploration program that we're doing with the kids. Do you want to talk? I want to talk a little bit about the food clinic, the feeding clinic that you're going to be working at.
Sure. So we serve kids that are have autism, other developmental disabilities, because feeding difficulties are common. Kids that have avoidant and restrictive food intake disorder. So we see kids that are still primarily fed through NG tubes or G tubes, so going through the nose down into the stomach, and then through kind of a port here on the side of the stomach to be fed. So I've worked with clients that were 11-year-old and still being bottle fed, and that was their only nutritional intake during the day. So he didn't consume any foods orally by mouth at all. So what we do, again, we determine what the function is. Usually it's escape from eating, because it's aversive, and that could be because they had a traumatic experience like choking. They had medical procedures done as a kid, and now feeding is also aversive. So there's a whole kind of wide range of kids will come into the clinic, but we serve all ages, I believe up to about 15. We use different strategies, all rooted in behavior analysis, to kind of increase the child's oral consumption of food. So whether that be liquids, actual foods, different textures of foods, different variety of foods. So we use all ABA principles to increase their quality of life. So we'll have kids come in for 6 weeks at a time for 6 hours a day. So they have pretty intensive feeding schedules that we're working with them. Then we have kids that maybe have to come in once a week, really depending on their needs. So I'll be able to, I did feeding before, and now this will be my intensive training here at Kennedy Krieger.
Oh, that's so great. What are you thinking you want to do, Lyndsay, after you get your doctoral degree? What are you thinking?
I want to, I probably have my own clinic, but I'm really interested in the relationship between feeding and severe behavior. We have kids, when all they eat is pizza every day, and now they're constipated and they're engaging in self-injury or aggression because they're in pain, kind of looking at that relationship and how we can, but then also it's hard to treat feeding if they have such severe self-injury. So kind of opening up a clinic, I really enjoy working with kids with a lot of problem behavior, and just helping the families, and it's really life-changing, for the kids. So that's really what I want to do. Maybe I'll come back to the Center for Spectrum Services.
Jamie, see, I called you Jamie. No, Jamie runs the center. So, and Jamie's still on, I think, too. So she heard you say that, Lyndsay. That's great.
Yes.
No, my question has to do with, now like with play and increasing, increasing food, but increasing play. Can you give last week we had Tom Caffrey on talking about the pairing process and increasing reinforcers. I know a lot of times, I also just want to talk a little bit too, before you head off, about the role of parents in the clinic and the parent training component. But can you talk about, maybe we'll start with parents before we talk about the pairing of the reinforcement. Just talk a little bit about parents and the role that they play in the development and in the positive outcomes.
Sure. You mean with like FCT as an intervention?
Yes, with understanding. So maybe helping parents understand that inadvertently the behavior had been reinforced all this time, and what that aha moment is for a parent.
Yeah. So one of the big keys that I have seen is, we use data for everything. So we graph every time, the number of self-injurious behavior, the number of aggression behavior, and really showing the parents that is when we put this intervention into place, your kid hit himself 20 times and now it's down to 1 or 2 times per session. So using that data, because the data doesn't lie, to show them that, but also explaining, it's hard to be like, well, the kid did it because you gave him the iPad every time he cried. So very tactfully kind of explaining that the kid is just used to this. It, was easier because it helped them, stop screaming when you gave them the iPad. So that's why this happened. But now we're going to teach them a new way to respond. And I always just use like real life examples, for them as well. Like if they were ever upset and, as a kid, they learned, that if they stomped their feet or something, they would get what they want, but now they have to ask for it. So giving them an example. And then during all these training sessions, like even the ones that you see in those clinics and how it is at Kennedy, and like for us, we had one-way mirrors. So the parent was observing the sessions the entire time, watching what the therapist does. For us, we also had the therapist come in the room, parents come in the room watching us, and then we actually do parent training sessions separately, then also bring the parent back into the room, have them run the sessions, and we give them feedback as well. Because it doesn't make a difference if he can request for me, but he's still engaging in the problem behavior at home. That's, we wanted to generalize across different settings. So we all have to be consistent, because if he's still learning that I scream and punch you at home, it's more likely to still happen in school. So we really want that continuous, across our spectrum of settings to have, the intervention be implemented the right way. So parent training is a huge part of this, and really the only way that it is successful in real life. It can be hard for the parent to watch at first, but I just talk them through it and explain through it too. Same thing with, going through the extinction bursts. We're going to see behavior get worse, and I promise you it'll go back down. And at the end, they're like, you were right, so right. Kind of always using visuals to show them. I'll show them a little graph that has an extinction burst on it, showing them the data. Each session be like, he did it 4 times, we're going down, keeping the parents involved.
Right. That's one of the things that we're finding in this virtual reality is now, through the use of this telecommunication, we're in families' homes as teachers and therapists. And so now it's a whole new landscape. It's almost like back to early intervention, where you're providing parent training within these natural routines. And one of the things that we're finding sort of collectively across teachers and therapists is that understanding some basic principles of behavior, like inadvertently reinforcing challenging behavior, these are the kinds of tools that we need to go back and give our families, because they may have heard it and they may have seen it in school, but they're having a hard time implementing it at home and in the natural settings.
Yes. And it's even harder too when you've been with a child for 24/7 now, and you're already exhausted, you're mentally fatigued. So, working with the parents, but I always tell my parents, I'm like, knowledge is power. So I want you to understand why I'm doing what I'm doing, the tools that I'm using, because this is how the whole world works. And this is how, you'll be able to, so the more knowledge that they know, just those basic principles, even teaching parents how to contrive opportunities to man is absolutely life-changing for them. They'll come back and be like, oh my gosh, you were right.
Right. It's funny, and parents, that the children who are significantly impaired with profiles that don't include language, that some of our families are not realizing that they can still put their cup in the sink. Yes. Even though he can't ask for a cookie vocally, right? He can keep his clothes on. He really can keep his clothes on.
Whoa.
So, it's important to remember too that you change the parents' behavior the same way you change your kids' behavior. So telling them they're doing a good job, giving them corrective feedback. It's the same way that we change our kids, we change the parents.
What a great idea. Yes. Reinforce the parents. And wouldn't you say that when you teach these strategies, it's really the parents' behavior that you're changing?
It is. Yep. The parents are the change agent for the kids most of the time. Like that's the behavior that we want to change is the parents' behavior. And that will then in turn change the child's behavior.
I'm writing that quote. Parents are the change agent. Yes. Yes. One of the things that we're working on right now, I think I told you, are these small behavioral modules.
Yes.
And so, meeting with some people today, and we're definitely going to be including some of your information.
Well, good.
Yes.
And I don't know if the VB MAP put out a free parent training that we've been using a lot. That's been helpful. And they cover like basics of ABA essentially for parents with video examples and everything. So that's been a great tool.
So I know there are free videos available on YouTube that Mark Sundberg has done.
Yes.
But maybe, do you want to put these? So what would I search for these parent videos?
I can even send. I'm going to send the link in.
Send the link in the chat.
chat. Yes, that way you guys can all have access to it. It should still be free. I don't know if there was a time limit for it. They were doing it for a while, but I think it was maybe towards the end of June that it was going to expire. But it's it's like an 8-hour training, but you can go through it at your own pace, and it gives examples of manding. It explains problem behavior for for parents to understand, and you get a little certificate at the end for parents as well. So it's an ABA 101 put out by the VB map, and I will add that.
Is that what it was called? ABA 101? Oh, that's
ABA
great.
101 for parents. So let's see, and if you click the link, there we go. And it should, you have to like create an account, and then once you create an account, it'll be free. If it's still free, it should still be free. It's offered.
So what people can do, if you don't know that, just highlight that link, highlight it, right click, hit the word copy, and now you can put it somewhere. You can put it on a Word doc, you can put it in your browser, you can put it somewhere. I'm going to just save it right now. That's great. Thank you, Lyndsay.
No problem. Yeah, that's been helpful for parents, because now when we're saying, oh, reinforce that, they know, what does reinforcement mean?
We just had this conversation.
Yeah.
Janine's probably shaking her head like, yes, because it's hard to write, reinforce in a learning plan.
Mm-hmm.
And then, like you say, somebody doesn't know. Or the other one, like if he's having a hard time doing it, prompt. And then even just the word prompting. What does prompting mean?
Right,
Exactly.
exactly.
Prompt, gestural. And then don't forget, parents, you have to fade your prompts.
Yes.
So, yeah, it's an interesting environment that we're in right now, because this opportunity for parents, while it is really difficult for all those reasons that you said, they're tired, and some parents are working from home, some are not working from home. There is this little gem of the idea that this is a nice time to provide intensive training for families that will last a lifetime.
Mm-hmm. And the nice thing about it is you can give them like corrective, what I do with my parents is I watch them do man training, and I give them corrective feedback on through the computer.
Yes, corrective feedback through the computer. Oh, that's so great. Lyndsay, we can't thank you enough.
Thank you.
It was so great.
Helpful. I know it was a breeze. This is a hard topic to cover, in a short time, but if there's any questions, feel free to email me, or things I can clarify for everyone.
Thank you. Yes, everyone is, so people are writing, thank you. Catherine, remember Catherine from Janine's class? She said, thanks, Lyndsay.
Oh,
yeah, people are saying thank you. We really appreciate this. And I'm happy to take the PowerPoint that you gave us. I will share it with the department heads, and then department heads can share it with their teachers, who will then share it with their staff.
Awesome.
So
awesome.
Good luck to you, Lyndsay.
Thank you. Good luck to everyone, and stay safe.
Yes. All righty. I'm going to end the meeting now.
Okay.